Hi, I'm Dr. Brian Kaufman, a retired family doctor, a CLL patient myself, and the co-founder, chief medical officer, and executive vice president of the nonprofit CLL Society dedicated to the unmet needs of the CLL community. And today I'm going to be presenting a research paper from Survey to Resource Hub, Chronic Lymphocytic Leukemia, CLL, Global Support Provisions. This survey was conducted by the CLL Advocates Network, CLLAN, a vigorous global network of patient advocacy organizations who support those affected by CLL. My friend Nick York was the lead investigator and the author of the abstract, who also serves as on CLLAN's steering committee as the chair. I serve on that committee, and CLL Society is a proud member organization. These results were presented at the American Society of Hematology's annual Congress held in 2022 in New Orleans. Let's jump to the bottom line. This large international survey demonstrated the need for greater participation in networked activities to build global capacity, share learning with stakeholders, and provide resources among charities that serve the chronic lymphocytic leukemia CLL community. The survey revealed significant gaps in support service provisions in many countries and has allowed the building online of a free global directory of patient-facing resources. Let's get into the details. We'll start with the background. The survey's purpose was to understand what support services and resources are already provided by nonprofits and charity organizations that support local CLL communities across different countries. The collected information was used to build a global resource hub, a searchable directory of CLL support services and resources. What were the methods and who participated? The online survey was conducted by patient advocacy organizations. So understand, these are not patients directly we're going to, but patient advocacy organizations. And these either specifically focused on CLL, like the CLL Society does, or more broadly on blood cancers, like LLS, or on all cancers, like the American Society the American Cancer Society. The survey asked about 4 different areas. The first, organization, location, and service details. Second, CLL support, advocacy, and education services that were offered, not offered, but they wanted to offer. The third was the type of information that was developed with different patient clusters and how they were delivered. And the last was website links to support information services, resources, activities, and events. There were 63 questions. It was translated into 7 different languages. And the survey was completed between May 6th and August 2nd in 2021. What were the results? The 57 respondents represented patient advocacy groups in 40 different countries. 54% were members of CLLAN, and 46% were not members of CLLAN, the CLL Advocacy Network. As expected, 56% or 32 were from Europe, but every continent was represented. Most frequently reported barriers to providing services were lack of resources, human resources, such as staff and volunteers. Almost 3/4 of the group said that was the main issue. 66% cited financial resources and 42% lack of time. Non-member organizations tended to have less of a range of services, and while member organizations were more likely to provide CLL-specific information, overall, most information provided was more general about blood cancer or cancer and not CLL-specific. So what can we conclude? The survey has allowed CLL Advocates Network to build the first global directory of CLL support resources and services by bringing together available information in a shared central database and it provides free access to the international CLL community. The Resource Hub was launched in June 2022, and we give a link to where you can find this on the website. CLL Society highly recommends our readers from other countries access this valuable resource to find out what's available to them locally. We recognize that not every country has access to the CLL-specific services offered by CLL Society and by a few other international nonprofits, providing us with an opportunity to share resources with the less resourced regions of the world through our work with the CLL Advocates Network. If you want to get into more details about this 2022 ASH abstract, we provide a link to From Service to Resource Hubs, Chronic Lymphocytic Leukemias, Global Support Provision, and you can get into that, and you can also link to the Resource Hub itself. Thanks so much for listening. Stay strong. We are all in this together.